When did you first notice that your son was different?
Well, it all started on back to school night, 4th grade to be exact. We walked into his classroom and he took a seat at what seemed to be a normal-sized chair for a boy his age. His knees were touching the bottom of the desk and he couldn't even grasp onto his pencil due to the thickness of his fingers.
Billy Covington, a Caucasian 9-year-old boy, standing at a whopping 6'3", 200 pounds. For most children, 4th grade is a time of joy, spent coloring, learning to divide, and playing kickball at recess. But for Billy, it was a never-ending struggle to fit in.
My little Billy has always been a very sweet boy. He grew up in a normal house with 2 normal parents, but we began noticing he was, well, different.
Days that were previously spent laughing with his parents turned into a struggle to fit in his own home. Literally and emotionally, little Billy began hitting his head on every single doorway.
One of the memories that keeps playing in my mind is when Billy came home from school with tears in his eyes after receiving a physical at the nurse's office. He was taller than the ruler on the wall. He couldn't make out the beeps during the hearing test, and he broke the scale.
On his 7th birthday, Billy received a scooter. Then he was just a little larger than it. Now, Billy is completely towering over it and unable to make a complete ride. With fright and angst and frustration, he rides his little scooter, just to fall each time. Christmas cards turned embarrassing and unproportional.
When did you first become aware of your child's abnormal size?
I first became aware of Billy's size when I was teaching him how to play basketball. As a kid, he was always into books and drawing, so I thought it was about time I taught the kid to play some ball. I threw him the ball, and I noticed that his hand was the size of it. As he was going in for a layup, he hit his head on the rim because he was too tall. The hoop was at least 10 feet. After about an hour of playing, Billy looked as if he had just jumped in a swimming pool, but I soon came to the hard realization that it was simply sweat.
A normal, day-to-day, father-son bonding time gone bad. Oh, poor Billy. What will become of this? That's when the parents knew that they needed a professional for their not-so-little boy.
So what seems to be the problem with Billy? Well, his growth seems to be a bit expedited for his age. He has abnormally large hands and feet, and the thickness of his toes and fingers is definitely not normal.
In the recent weeks, we've noticed some excessive sweating as well as an inability to hear. Billy has expressed head pain on numerous occasions, and as well as not being able to fall asleep at night, we just figured it would be normal for a kid his age.
Yes,
From my initial screening of your son, I've seen he has a prominent jaw and forehead, along with many coarse facial features.
What do you suggest we do?
To start, I will have to run a blood test to measure levels of growth hormones and insulin-like growth factors circulating in the blood. IGF-1 is secreted into the blood primarily by the liver in response to growth hormone. I will also run an oral glucose tolerance test. With this, your child will drink a special beverage containing glucose. Blood samples will be taken before and after he drinks the beverage. In a normal body, growth hormone levels will drop after eating or drinking glucose. If your child's levels remain the same, it means their body is producing too much growth hormone.
Sad and confused, Ellen and Monroe Covington cried together as something could be horribly, horribly wrong with their young Billy. Dr. Gail Ferguson ran numerous tests on Billy. She first ran a blood test to measure the levels of growth hormones and insulin-like growth factors circulating the blood. She also ran an oral glucose test just to rule out any possibilities for poor, poor Billy.
What did you find, doctor?
Well, with the IGF-1 blood test, normal cases would indicate that a high level of IGF-1 would signal the body to stop producing growth hormones. However, with your son, regardless of how high his IGF-1 levels are, his body continues to produce growth hormones. Additionally, the glucose tolerance test did in fact show that Billy's growth hormone levels didn't drop despite his intake of glucose. With that being said, along with my observations regarding his physical appearance, your son has gigantism. The disease is not hereditary, so please do not blame yourselves. Billy is one of only 100 cases reported in the United States. A stop can be put to this horrid condition. I recommend an MRI scan of the pituitary gland, which is used to find the tumor and to see its size and position. After that, you'll have to make a decision. My physicians and I can perform surgery to remove the tumor, or we can put Billy on medication to either shrink the tumor or to stop the production of excess growth hormones. Another treatment that can be performed is gamma knife radiosurgery. However, since the radiation in this type of surgery has been linked to obesity, learning disabilities, and emotional issues in children, it's usually only used when other treatments don't work.
After a few days to consider their options, the parents decided to go along with traditional surgery. The surgeon reached the tumor by making an incision in Billy's nose. Microscopes and small cameras were used to help the surgeon see the tumor in the gland. Billy was able to return home from the hospital the day after surgery. Months after his procedure, Billy had no follow-up symptoms and didn't require additional medication. Billy will continue to have regular medical checkups to monitor the growth hormone and insulin-like growth factor 1 to detect any growth of the tumor. Ellen and Monroe Covington even got their little Billy a therapy dog to help improve his emotional and social skills.